Hi, I'm Dr. Joseph Wittering. It's my pleasure to welcome back Nicole Lamberson. And today we're going to be talking about, um, I guess, two topics. How to get a doctor to help you with a taper if you need to do an a slow taper, and I guess some of the problems that people encounter when they're looking to find doctors and people help them and to help them do this and strategies to help you overcome this. So yeah, that's the topic. Welcome, Nicole. Yeah.
Thanks for having
Yeah.
me.
Mm.
Yeah. So I
Um,
want to
mhm.
start by asking you something. And that is when we talk about this topic of finding a doctor, finding a provider, because it doesn't have to be a doctor. It could be a PA or a nurse practitioner, or a psychopharmacologist, depending on where you live. Why do you think that so many people come forward and have trouble with this? Like in the withdrawal communities, we hear all the time, like, I went to my doctor and I asked for help tapering, or I told him I was having a hard time coming off, and he wanted to like control it and tell me to come off in 4 weeks and I would be fine, or he didn't want to hear anything about it. Um, why do you think there's just so much like resistance to the topic in general when you bring it up to your physician?
Sure. Yeah. Um, okay. So I guess I'd start by saying that the way most physicians and prescribers were trained when they were in medical school was that you know when you're coming off a benzodiazepine, the withdrawal lasts 2 months, something like that max. Most of it's gone in the first 2 weeks. When you're coming off an antidepressant, this is something that lasts 3 weeks or something like that, uncomplicated. That is the message that they've been heard. And the reason that they've heard that message is the clinical research supporting that came from the trials that we use to get the drugs onto the market. And, what we know about those is most of them only went on for, 4 months, something like that max. Maybe there's 500 people in there, or maybe, up to 1,000. And so when they actually discontinued those participants from the drugs, they'd only been exposed for like 4 months. And a lot of them really did have uncomplicated withdrawals. And, they didn't have any issues. It's uncomfortable, but they recovered pretty quickly. And so there's a lot of publications out there about that. And that's also for a pharmaceutical company who is selling antidepressants, one of the biggest concerns that, physicians would have asked them is this a big deal? Do patients have, these horrific withdrawals when they come off? And they would have had a whole team of, medical affairs correspondents who are out there publishing this stuff saying, it's called a discontinuation syndrome. It's self-limiting, it recovers quickly, because that is addressing the concern for the physician. But the issue is that's not, that population that was in that study is not representative of the people these days. Many people are on these medications for decades, and so it does not make sense, that same kind of rapid withdrawal would work. But there's a ignorance about it out there, and people just assume, oh, this was, I've read this in the medical literature, and that looks like, and it's very credible. It's got like an author line listing of the top people in the field. I'm just going to go with it. So, yeah, ignorance is probably the main reason why people are getting pushed.
Yeah.
And mhm.
And maybe there's just some, I mean, doctors and PAs and nurse practitioners are they're just people, right? And so just like you encounter people of all different personalities in your life and everything else, I feel like there's doctors and medical providers who are just more open, more critically thinking, more willing to, be patient and compassionate. And maybe some others who are just like more impatient. They don't want to deal with it. Or so that's kind of like you as the patient, the consumer, um, sort of is left to have to deal with that. And if you get somebody who's more on the impatient side or who just isn't willing to change their thinking, I think that's what we're going to talk about next, is like how to work
Mhm.
through that if that's what you're dealing with.
Yeah, yeah. Definitely, I think, anxiety can play a big role. If you have a provider that's very anxious and maybe kind of very defensive in the way that they practice medicine, they're going to want to follow the guidelines. They're going to want to do what is in that publication that's been supported by, you know, all of these well-known authors. And if you tell them to stray from that, then they go, you know, that's not for me. No, thanks. You know, I just want to be in this little box and practice here, and that's where I feel comfortable. And that's not going to be the right person for you if you're having a complicated new adverse reaction type issue and you need and to come off. They're not going to really be able to help you with that. And I guess the next thing, you know, Nicole, you mentioned like, you know, how to get, you know, transitioning to how to get your doctor to help you. I think what I would say is like, you know, don't be, you know, don't go in there and be very like kind of confrontational and come in and say something like, you know, no, all of you doctors are the same. You know, you just kind of put people on this stuff and you don't realize how bad it is and you've ruined my life. And that may be true. And I don't want to diminish the fact that a lot of people do feel that way. And that has happened. You know, they've been unwisely prescribed these medications for long periods of time and it has caused damage. But it's not really the way that you would coax someone into helping you because, you know, like Nicole was saying, and I guess like I was saying before, you know, these are just people out there, and I don't think there's any malice going on. It's really just an ignorance about it. So if you can come in and, I guess what I would say is, you know, educate them about it and, you know, what you're suffering from, you know, whether it's protracted benzo withdrawal or, you know, a problem with an antidepressant. If you can start by educating them, that's always a good place to begin.
Yeah, I can attest to the coming in guns blazing, just being so angry. I did that with the doctor that was my prescriber. I mean, I wasn't mean or, you know, horrible, but I was very much confrontational. Like, I think I'm having benzodiazepine withdrawal. It's right here. You know, I brought my dad with me. And I think probably what she saw in her mind was like, oh, crap, lawsuit or something, you know, and I was fired as a patient immediately. I got a letter like a couple days later in the mail. And so maybe in cases like that, like you can't work with the doctor who did this to you if it's too, you know, emotional or that kind of thing. You may have to find somebody else if it's like that triggering or they're on the defense because they're the ones who were prescribing. But I have met people who did go back to their prescriber and it was kind of like a, you know, a forgiveness type thing. Like you didn't know any better. I didn't know any better. And then they apologize and sort of work together to solve the problem too. So, yeah.
Yeah. And that can be, well, actually, I want to ask, what was the rationale for firing you when they sent you the letter? I mean, did they say like, yeah,
well,
oh, I don't think I'm able to help you anymore, you know, something like that? Or
yeah, I have the letter in my
yeah,
closet. I'll have to go back. I kept it because it pissed me off so bad. But
yeah.
I think I had missed an appointment because I had agoraphobia so bad from being in cold turkey withdrawal. Like I couldn't leave the house, you know? So like I had missed an appointment, but I managed to go to this other one and my dad took me and he sort of said to her, like, I don't think you're supposed to keep people on benzos for 5 years, you know? And then she just sort of started getting all flustered and the whole thing got weird after that. So,
Sure. Yeah.
yeah.
And I want to say that's been known, you know, since like the 80s, by the way, you know, they're not meant to be used long term. So there really isn't a lot of good excuses for that unless, I mean, you've tried like a million other things and it's like the only thing that allows you to function. But
yeah.
Oh, sorry, you going to say anything, Nicole?
I was just going to add to your part about like when coming in with information too, I would just add like an asterisk on that to say, keep in mind that providers have a limited time. And so I've seen patients who are just so, you know, they want the doctor to know everything. And you've got what, like 10 or 15 minutes. So if you come in with, you know, printed out stacks of every journal article you can find and you want them to watch an hour-long interview with somebody and videos, and like you're probably going to be disappointed because they're just not going to have time for it. So like maybe prioritizing the information that you're going to bring to them and sort of condensing it into something that they can, you know, sort of easily consume in a reasonable amount of time, I think.
Yeah, yeah. So maybe a good example of that would be, say you have a benzodiazepine injury. You've, you've developed, you were rapidly tapered, and now you're back on the same dose. I mean, the first thing I think to justify that, hey, I need to do a slow taper might be, I actually think I've developed, protracted withdrawal, and oh, by the way, here is a drug label. It's a fairly newly recognized side effect. It only came out a couple of years ago, and you could just like highlight a little section in the drug label and say, as you can see, I have these symptoms now, and there's something called the Ashton Manual that's out there, which is essentially recommends a slow taper, and I think that might be something good for me. It would be 5% cuts every 3 or so weeks. I could work with a compounding pharmacy. Do you think you could support me doing this? So that might be a simple way of doing it for benzo injury. Antidepressant protracted withdrawal is kind of more complicated because it's not recognized by any regulators, and there's also less. I don't know. Maybe this is not true anymore, but I feel like there's less in the medical literature about this, but there's still a fair amount. So the way you might go about that is, I think I have, I've tried to come off my antidepressant. I developed all these symptoms. I think I'm developing this post-acute withdrawal. There's this article by, I think it's Adele Farmer, and I think and we'll put a link to this below, but this was published in the Therapeutic Advances in Psychopharmacology. And the title is What I've Learned from Helping Thousands of People Taper Off Antidepressants and Other Psychotropic Medication. And it's really well referenced. And you could just say, there's more publications about this, and there's other people having this problem. And really what I'm looking for is someone who could, support me with a slow taper through a compounding pharmacy. I mean, it's the same thing, roughly 5% cuts every 3 to 4, weeks. And that might just be where you leave it, not kind of overwhelming them, but say, I've got some stuff. If you want to look at it, you can. If you do, a lot of people, I think if you just say it, they might just say, yeah, that sounds reasonable to me.
Mm-hmm.
Yeah.
What do you think about showing up with, a spreadsheet? Like, this is how I plan to do it. This is what I plan. I've done some research online, and this is what it's going to look like. What do you think about this? Or do you think, that's too, like some doctors would be offended by you having a plan in place already?
Yeah, I don't know. I mean, I might do it reflectively if they ask for one. But I feel like, in this day and age, like I could just see someone just groan, if you handed them this thing, just like, oh, like I don't have time to read this, and so, yeah, I would just keep it pretty high level.
Yeah.
And then,
because some doctors
yeah.
are, well, you tell me if you've encountered this too. I feel like some are a little more scared too of some of the more non-conventional ways of tapering that patients have come up with, off-label type. Oh, well, I'm going to make a mixture in my kitchen with, water or whatever versus like,
Yeah.
Yeah.
Yeah. That's true. I think the compounding pharmacy sounds like the least threatening than, oh, I'm going to do dry cuts, or I'm going to go do this liquid taper. And you may need to do that eventually, like a liquid taper. That's a necessity for some people, but I would just start with working with a compounding pharmacy first. I think that, it's going to the pharmacist, they're, doing it to certain specifications. I think that's like, seems the least unusual, because a lot of doctors do have experience with compounding pharmacies when they make creams and different ointments and things like that. So
yeah,
that's probably a good place to start.
Yeah. Well, there's probably a difference too between patients who like took benzos, for example, for some physical problem, like, Dr. Christy Huff, her story is out there, and she had like dry eye or something, versus somebody who has been seeing a psychiatrist and who is diagnosed with a mental condition, whether they believe that they truly ever had that diagnosis or not, right? Because a lot of people present and say, well, I don't think I really even had that, and I just got over medicated or that the drugs cause them to have psychiatric symptoms. But do you think it's harder to convince, a psychiatrist that you want to come off of your meds because of the whole, like, you're coming off of your meds, and then what are you going to do about your mental condition versus somebody who's just taking it for like back pain or something?
Yeah. I think if you have like a psychiatric condition and you're stable, I don't think it would cause as many problems if if you're like, honestly, doc, I don't feel like this is working for me at the moment. I still have depression and anxiety, but I think it's manageable, with family support. I think I'll be okay. If you're working with a counselor, throw that in as well. And, really, I'm just looking for someone to help support me to continue this. I mean, they should support you on that because, essentially you're no longer consenting to be on the medication and you just want to come off. It's a different story, and you're going to get resistance if like you keep on saying like I'm suicidal and I'm really unstable, and so that's going to raise more red flags. And a lot of people, if you're in these protracted withdrawal like phases, I mean, you might feel like that genuinely, and then that's when like the education piece becomes really important, and you would need to say, the way I'm feeling now, I actually, I don't think this is my underlying condition, and here's why. And that's when you need to say, again, here's the FDA label, this was updated for all of them. As you can see, I've got, cognitive impairment, sensory abnormalities. I have, neuropathic pain, which is new. It's kind of all emerged like right after I had, an abrupt withdrawal. So I think it's temporarily linked. And this is just completely different from my previous condition. Bring a family member along, my wife is here, she can attest that this is actually what's happening, and I've had a real change in my condition, and she's going to watch me closely. Guns are out of the house, and we just, I actually feel like, this drug has injured me, and now I just need help coming off, and I'm going to do my best with non-pharmacologic treatments. I mean, that might be the way you would spin it if you find yourself in this position with this drug injury where you actually do have pretty severe depression and anxiety, which is very common.
Yeah. And this one's kind of controversial too. Like the provider who may be willing to help you, but they're kind of on the fence because they don't really understand the difference between physical dependence and addiction. And they're worried you're having withdrawal, and sometimes withdrawal raises red flags in them and they start thinking addiction. What do you think about like doctors? I guess if you need the medication, you don't really have a choice, but like, I've heard of some people having to consent to urine drug screens to continue to get the prescription in order to taper, or, just suggesting like, you're free to look into the monitoring, the PMP or whatever, where they can pull up and see that you haven't filled your benzo at other places,
Yeah, I mean, if you have to agree to do like a urine drug screen, I mean, it kind of sucks because you'd have to pay for it. But I mean, if that's like less inconvenient than finding a new person, then that's I would just go for it if it helps that provider work with you and you'd rather not find another one. That's all good. But this is kind of where like really like family members can come in helpful, because what they're concerned about is what they're saying is like, I don't know if I can trust you on your own here, telling me that you don't have, problems with addiction in the past. But if you have like a parent or a sibling or a spouse there just saying, my husband he's never had any problems, with addiction. He takes the dose just as prescribed. He always has. And, really supporting your story. Yeah, he went through this withdrawal and now like, he's got these inner dose withdrawal problems and things like that, and it's completely new. That's where the support of loved ones and family members helps. It helps the physician because they can put in their note, patient's history does not support problems with that they've had problems with addiction. I have a low suspicion that they're diverting their drugs. They're always taking them as prescribed. This is supported by the wife. It kind of will let them feel a lot more comfortable doing it. And you may even, if you come in that way, even if you do have like a drug use history and you might be on Suboxone, or maybe you've had problems with alcohol in the past, I mean, you're already going to raise suspicion with that prior history. But if you have a loved one who's very credible and can come in and talk, yeah, I'm watching them. This is not happening. We really need help. I mean, yeah, you might be able to get away from doing drug tests and all of that. So yeah, that's what I think about that.
Okay.
Yeah.
Do you want to move into like, finding a doctor, some suggestions? Have you come across any good resources for that?
Yeah, well, I think the best resource is your resource, Nicole, over at the Benzo Information Coalition. You have that list of doctors by state, which is really good. And then also there's if you search surviving antidepressants, find a doctor, there's a thread there, which is like find a doctor, therapist, that are all wise to the withdrawal problems. And you could kind of scroll through the 11 pages there and go to like the most recent ones and kind of just see who people are going to and who people are recommending. And then also there's a lot of Facebook pages out there for people who are going through withdrawal. Cymbalta hurts worse. I mean, there's a huge Facebook group. I think there's like 36,000 members in there. So you could also post in there, anonymously. I live in this state. Who could help me with this, and they may be able to help you. There's countless other ones for benzo problems on Facebook, and so those would be the main ways. Can you think of any others, Nicole?
Yeah, the Withdrawal Project has something called Connect on their website, and you can make a profile and put in your location, and then you can search for other people within, like a certain radius of yourself, and then send them a message. So you could message anybody within like 60 miles of you and say, hey, do you have a doctor who's helping you? And I think compounding pharmacies are good resources, because if they are compounding psychiatric meds for tapers for somebody, they'll know who the doctors are who are calling in those compounded drugs. And so you might just call up your compounder. There's probably a couple within a driving distance of your house, and just ask them what doctors are prescribing compounded benzos or compounded, antidepressants, and then give them a call. And then I think lastly is like, just ask your social networks, ask your friends, your family. That's how I found my doctor. She was like the wife of a physician that somebody in my family knew. So you can network a little bit and see if anybody has any suggestions for you too.
And that makes sense. I mean, if you have a personal contact, I mean, it's like a warm introduction when you go into that doctor's office. They've already been told by, that intermediary, yeah, Nicole's a good person. I mean, she's never had any issues before, nice family, they're going to be way more interested. Well, they're going to take the time to listen to you, especially if you're coming in with something a bit more unusual.
Yeah. And I took my dad with me, like you were saying, bring an advocate. My first appointment, I took him along, and that was hugely helpful. I mean, I was in a state anyways, just, I was not in a place to advocate for myself anyways. So I can attest that that's hugely helpful. Yeah.
And what was that like? How did that relationship take off? Because I've heard you talk about her before and how, she's fully like benzo wise now. You've kind of, fully educated her on it.
Yeah. I mean, she didn't know anything about this really. But, like I said, my dad was there, and he knew her husband, who's a surgeon, and she's a forensic psychiatrist. So we had that connection. And he just sort of said to her, like, I know my kid, and this is not who she's ever been. These drugs have made her this way, and I've watched it happen. And so he sort of gave the history and everything. And I think because of that, she was willing to learn and read and educate herself. And she read the Ashton manual, and Then she just started digging around and just sort of like developed a passion for it. And, I'd go in and she would say, oh my gosh, it's the antidepressants too. Like it was like she just was slowly devouring the information. And at one point, she apologized to me, even though she wasn't the one who prescribed the drugs. And that was like hugely healing for me just to hear that, like, she's like, I'm so sorry this happened. And, I didn't know I was prescribing these medications to people. And I just thought, like, if something horrible like this was a possibility, I would have gotten a letter from the FDA or, and she was like, I didn't know. And so that sort of helped me, get past that anger and rage that I harbored for a while at the original prescribing physician. But it was just time and us working together and developing a relationship and getting to know each other. And, now I kind of laugh. It's sort of embarrassing. Like the psych office calls to make an appointment, or I call them, and I guess it's caller ID, and they're like, hey, like we just know each other like so well at this, at this point. So yeah, it's like a friendship.
Yeah. That's interesting. I feel like I'm friends with so many compounding pharmacies because I'm putting in like orders every week at the same one for some of my patients. It's me again.
Mm-hmm.
Yeah.
Yep.
Okay. Gosh, Nicole, I feel like we hit all the bases we wanted to talk about. Was there anything else that you think we missed?
I just say the last thing, I guess, is like it may be kind of controversial, but in the withdrawal support groups, there are like a handful or so of people who just are like, I have tried everything. I cannot find a doctor who will support me. And so they will, sometimes be forced. They want off of the medication so bad that they sort of self-educate and they just continue getting a prescription for the drug, and they taper at home, safely. They learn the techniques and that kind of thing. It's obviously not ideal. It would be great for everybody to have a supportive provider, but I guess sometimes people sort of just feel like they have to do what they have to do. So
Yeah. And I guess, we're not necessarily, not recommending people do that. Like Nicole says, ideally you always do it with someone, but that is, I mean, we have heard some people withdraw, about how they had to withdraw themselves in that way. And it's not ideal, but that's just kind of reality of what happens when you can't find anyone. And I guess, the plug for my practice is, if, other things that can be helpful, like say, you're not in one of the states where I'm seeing people, you could come to Utah, and this could be like a consultation from your family medicine doctor to me. I could assess you, write you a report, and then keep in touch with your family medicine doctor. And that would give them, I guess, the support to say, hey, this is not me doing this kind of crazy taper. This is consultant Dr. Whit During advising me. And, that might just be another thing to kind of knock them over the edge to say, you know what, this seems reasonably safe now that someone else is on board, and saying that it's okay. So I think this is probably a good place to wrap, Nicole. I mean, your insights are good, and I'm really, it's a pleasure to talk with you about these things. And this is kind of an ask for the audience. In the comments below, tell us about some of the difficult situations that you've had with physicians. What happened. We'll integrate that into our next talk that we have. We'll try and kind of think about different strategies that might help you address them. And any other comments and questions are always welcome below. We appreciate you supporting the channel. So, yeah, great. All right. Well, thanks, Nicole, and you take care.
Yeah, thanks.